In the short term, the article highlights that this dietary pattern to be safe and effective for people with 4 type 1 and type 2 diabetes in glycemic health and drastic reduction in physiological blood glucose is observed due to the lower carbohydrates loads entering the body. This minimizes sudden spike in blood sugar reduces dosage variability and improves time in rate and a metabolic level. Evidence shows a decrease in glycated hemoglobin level and reduction in required dose of insulin and oral hypoglycemic agents double weight loss, improved insulin sensitivity and optimization of cardiovascular is for same as systolic blood pressure.
Most of the studies analyzed in the article demonstrate that the favorable clinical effects tend to disappear or significantly decrease after 12 months. This does not occur due to a biological failure of the treatment but primarily because of a decline in dietary adherence over the long term. Since it is a diet with strict restrictions on commonly consumed food, such as refined starches and sugar, sustaining it over time is extremely difficult for most patients. For this reason, the consensus ahead that the dietary plan guide must be regularly re-evaluated and individualized by nutrition and diabetes specialists.
The article details a clear group of contraindications where this type of diet is not recommended by any circumstance. These include pregnant or breastfeeding women, children or teenagers, people with chronic disease, and individuals who have or are at risk of developing eating disorders. Additionally, it is strictly forbidden in patients medicated with sodium glucose cotransport 2 inhibitors, as combining extreme carbohydrate restrictions with this drug dangerously elevates the risk of developing euglycemic ketoacidosis and severe medical complications where ketone bodies accumulate despite normal or near normal blood sugar levels.
The article explains that the production of ketone bodies is formally activated when daily carbohydrate intake drops to very low range specific between 20 and 50 grams per day, as glucose availability decreases in the bloodstream. The liver depletes its glycogen stores and must find alternative pathways to supply energy to vital organs like the brain. To achieve this, the liver initiates the process of glucogenolysis, which consists of manufacturing glucose from no-carbohydrate substrates, utilizes lactic acid, glycerol, and certain amino acids such as alanine and glutamine. Parallelly, lipolysis is achieved in adipose tissue to release free fatty acids to serve as general fuel, transforming parts of them into ketone bodies.
One of the critical and highlight debate points regarding low-carbohydrate diets is their long-term cardiovascular impact, given that when the energy nutrient carbohydrate is reduced, the consumption of fats and proteins inexorable. In a case, the article cites a review by Willett et al. That clarifies these relationships. The impact on the risk of cardiovascular disease (CVD risk) depends strictly on the source of the food. if carbohydrates are replaced by proteins and fats or plant origin. Cardiovascular risk decreases conventionally if the replacement is made with nutrients of animal origin, rich in saturated fats. The risk significantly increases. Therefore, the article concludes that the focus should not solely be on quality, but on quality and choosing nutrient-dense, minimally processed, and high-fiber sources.
Although initial benefit exists, the article warns about multiple important side effects in patients with 2T2. The first is hypoglycemia. There is immediate risk if dozens of oral hypoglycemic agents or insulin are not reduced when beginning to restriction. Second, dyslipidemia in increase if total cholesterol and LDL bad cholesterol levels infrequently observed. Third is digestive and microbiota alterations, the drastic reduction of carbohydrates usually causing constipation due to low fiber intake. Additionally, losing the protective benefits on a microbiota diversity. Fourth is bone demineralization, the mild metabolic acidosis state caused by ketone bodies, combined with high intakes of sodium-rich animal proteins, leads to breaching calcium through urine, which can jeopardize bone mass. Finally, loss of lean mass if the patient doesn't engage in regular structural physical exercise. The risk of losing muscle mass due to the overall energy deficit.